morning. This is being recorded so that we can post this on the Greenville First Steps website for folks who are not able to actually make it this morning, knowing that being a director in a school-aged program probably has everyone pulled in a million different directions at all times. So a couple housekeeping things before we get started. Everyone is coming into the session on mute. So for speakers, you'll just unmute yourself. But for folks, just make sure sometimes our computers and our phones and stuff want to unmute us, even though we didn't click the button. So we'll just make sure to stay muted. And then if you have any questions as we go along, you can throw them in the chat box, and I'll be kind of monitoring that as we go. And we'll try to get to as many questions as we can at the end of the session. So this call kind of came about after some questions about a lot of folks are creating school-age programs, and there is a ton of information out there on how folks should respond should a coronavirus case come up in their center. What should they do? Who should they call? Should they call anyone? All those kinds of things. And so we have two folks with us today who are going to kind of share. We have Janet Lage from, Janet, did I say that right? Now that I...
That's okay. I'm used to that. It's Loggy.
Loggy, I knew that. So Janet Loggy, who's the Director of Health Services from the Greenville County Schools, we'll be kind of talking about the policies and procedures that the school district is implementing. And then Julie Hollister, Association Director for the Youth and Family Services at the YMCA of Greenville, will also be sharing with us what the YMCA of Greenville is doing. And at the end, we're hoping to have some time to maybe throw out some scenarios of if this scenario were to happen in your out of school time, childcare center, whatever location you are. How should you respond to that, and kind of what are the best practices? So one quick thing before we get started and let our guest speak, I just wanted to send a reminder to everyone that for the CARES Act school age grant, all funds must be spent and reimbursements need to be submitted by October 31st in your online portal. They must be spent on unbudgeted expenses. That should say unbudgeted expenses related to COVID-19 and implementing a school age program for full day Greenville County school students. There are three types of reimbursements that you need to submit. You can submit a payroll reimbursement for staffing expenses related to your school age program. There is a template that makes it super easy, so you don't have to submit pay stubs or anything like that. That template is on our website, and there's also a link in your portal as well. Then you can submit site expenses. So if you had to buy desks for school-age children, if you had to buy headphones or enrichment materials or anything related to your school-age program that was unbudgeted, you submit one PDF in your portal that combines all of those receipts. And then you have to justify the 20% required to be used on financial assistance within that system. For a step-by-step guide for how to do that, including pictures of what the system should look like for you, it's actually on our website, greenvillefirststeps.org/CARES-Act, and you can also always call and email me if you have any issues. So just reminder, October 31st is the deadline for that. So a quick little disclaimer on Greenville First Steps part, and I'm just going to read the screen, but Greenville First Steps is committed to providing school age and childcare providers with the advice and expertise of community partners to assist with operations. However, we are not a regulatory agency, and any questions about what is legal or permitted under SC or federal law should be addressed with DHEC or DSS. What you're going to hear today, this goes with the school district as well, and our other speakers. What you're going to hear today is guidance as of today that is being provided by DHEC and CDC. We all know that things seem to be changing on a daily basis. So the information is kind of best practice as of today, but know that tomorrow it could be something totally different. So just keep that in mind as we go along. So we are actually going to start with Janet, and I am going to stop my screen share and give the screen share to you, Janet, who's going to share a little more with us.
Sounds good. Whitney, I know we didn't discuss the frequently asked questions document. Did you want me to review that or not?
It's up to you. I think if you wanted to go over some of the definitions real quick, and then we can just provide that document afterwards, I think that'd be great.
Okay, let me just pull that up real quick.
Janet, you should have access to share your screen now.
Okay. Can everyone see this?
We can.
So good morning, and thanks for joining us this morning. Thank you to Ann Lee and to Julie for putting this together and giving Greenville County Schools the opportunity to speak to child care providers in Greenville County. We appreciate what you're doing for our students and the support that you're providing. I'm here today just to talk to you about protocols we are implementing in the school district, strictly following guidance by DHEC, our South Carolina DHEC, in close contact with upstate DHEC. So that's where all of our protocols and implementations for COVID-19 are coming from. We put together a childcare FAQ, essentially with just different terms, and I won't go into each of these, but these are all very important definitions that everyone should familiarize themselves with. I think it's very important to understand the meaning of these terms because they can be confusing and they can be conflicting. So when we're speaking of, for instance, symptomatic versus asymptomatic, or isolation versus quarantine, and we will talk a little bit more about that, that we know what we're saying and what terms we should be using, and to educate the public on that as well. I think COVID-19 is going to be here for a good long time, and it really is going to serve us all well to understand all of these definitions. A lot of, pardon me for going back and forth here, but a lot of the precautions that are taken within our program and is hopefully adopted in your program come straight from CDC and DHEC. And here are the things that we are using: social distancing, masks, hand hygiene, cleaning and disinfecting, staying home when sick, cohorting students, and participants in a child care program. And we'll go into more about cohorting, and just some information on what to do if a student or a staff member in your program presents with symptoms. And I won't spend a lot of time on this, and feel free to ask any questions or reach out if any questions would come up from this resource that will be shared with you. I included references on that. And there is a disclaimer down here. Please make sure that you are notified that these definitions, protocols, guidance come strictly from CDC and South Carolina DHEC, and resources from other medical providers in our community. And this information is being shared with you today, and it could change as soon as tomorrow. And we'll do our best to keep up on the latest information, but just know that this is what the research I have done and the literature research with these entities shows us. today. And I will move along to our PowerPoint here. Can everyone see this?
We cannot see your screen.
Okay, I got a message that screen sharing ended.
Okay, let me try and give it to you again.
Maybe it's one document at a time.
Yeah, it might be. Should be able to.
Okay, I'll try again. Yep, it looks good. Bear with me, I'll have to pull it back up.
Here we go.
Can you all see that?
We can.
Okay, good. Is it a full screen for you?
It's close enough.
Good enough? Okay. So just briefly, I can talk for days on this subject, but briefly we put together a little slideshow or PowerPoint on the process for COVID-19 cases and exposure in the daycare setting, based on again CDC DHEC guidance, and this is essentially what we follow in the school district, and we think we have a pretty good plan in place. Again, our disclaimer that the information provided here is based on information that we have received as of today, and that guidance does change frequently, and we will do our best to keep ourselves updated and in turn update our childcare provider partners. Just an overview, we're going to talk about quarantine versus exposure. What is close contact exposure? What does contact tracing mean? A little bit more on cohorts, and how do we handle positive cases in the childcare setting?
And Janet,
sorry to interrupt, but your slides aren't advancing for us. We can only see the title slide.
Goodness. Okay.
Gotta love technology.
Let me. See why.
so when you click share, you can actually share just the PowerPoint. And for a second there, we saw a button that said resume slideshow, perhaps.
Yeah, that's because I stopped it. So try it again.
If it's also easier, you're welcome to shoot it to me in an email really fast and I can pull it up as well.
Sure, maybe we'll have to do that. And like, sorry, I don't know why it's not.
All right.
Bear with me.
Henley, I just sent it to you, so hopefully it'll come through in a second.
Okay.
Did you do the 10 o'clock one?
Yes, let me double check. Yes.
Thank you. There it is. So I stopped sharing.
Okay.
It's obviously not working.
All right. Okay. All right. Can you all see that?
I think
Yes.
we're on the overview, just finishing up the overview page.
All right. I'm ready to drive. Here we go.
All right. So we can go to the next slide. Thank you. Quarantine essentially is for someone who has been exposed. You quarantine away from others so that if you were to be incubating the virus from exposure, that you are not then exposing anyone else. We do understand that there are symptomatic cases and asymptomatic cases. And for asymptomatic cases, you are contagious 48 hours prior to your test for an asymptomatic person. So, or for a symptomatic person, when you develop symptoms, you were contagious 48 hours prior to developing symptoms. That is why we need people to quarantine once they're exposed, because we don't know when they're going to be out and about and perhaps develop symptoms 2 days from then. Quarantine requires a 14-day stay home, stay away from people. So you're asked to quarantine anytime you have direct exposure, direct contact, and we'll review what direct contact means, with someone who's positive for COVID-19. When you are quarantined, you should be watching for symptoms of COVID-19, which can be a whole lot of different symptoms, mainly a new cough or worsening cough, trouble breathing, or any respiratory difficulty. And also loss of taste or smell is a cardinal symptom of COVID-19. Isolation means, and I always remember isolation as being ill. So the isolation and ILL or ill means to keep someone who is sick or ill or who tests positive to COVID-19 without symptoms away from others, even in their own home. Child or staff member can return to work, or a student or a child can return to childcare settings if they have been home for 10 days, whether they're symptomatic or asymptomatic. They need to be home and away from others for a minimum of 10 days. And sometimes it's longer. If you have a severe illness, you might require a doctor's note, and that might be unique to your setting and unique to the person's circumstances or illness. 24 hours should pass from the last time you had a fever, which is defined as 100.4 or greater by the CDC, without the aid of fever-reducing medicine. Of course, that's Tylenol and ibuprofen, anything that will bring your temperature down. And that is a very important piece to make sure that we educate our parents about. And an overall symptom improvement, which is pretty subjective. And I would ask that you, make sure that the student doesn't have a frequent cough or doesn't have a runny nose that is constant, things like that. And you might have to determine what was normal for that student or a child, and then throughout their COVID illness and where they're at today. But again, it's probably more difficult when you don't have a nurse in your setting to determine that, but you'll have to interview the parent and decide case by case what an overall symptom improvement looks like and a staff member or student in your setting. We can go to the next slide. What is close contact exposure? That is a great question. And remember, it's that 48-hour window before symptoms appear for someone who is symptomatic for COVID-19, or the actual date of the test for an asymptomatic case. And the golden rule is 6 feet and 15 minutes. What you should be asking your providers or your employees or your parents, was the student or daycare or childcare participant or staff member within 6 feet for greater than a 15-minute duration of time to someone who has been diagnosed with COVID-19. Other close contact exposures include your home with someone who is sick and you're providing close care, contact care to them, and then they were diagnosed with COVID-19. That's a pretty simple one. You had direct physical contact with a person, hugging or kissing that person, sharing eating or drinking utensils. Maybe you had a student say, no, I wasn't within 15 minutes or within 6 feet for greater than 15 minutes, but I had a sip of their Coke. That is a direct contact exposure. Did this person cough on you or cough right in your face? We know sometimes children do that. So those are also ways that you can be exposed outside of the 6 feet, 15-minute rule. We can move to the next slide. The bottom of that previous slide, I just want to mention that is a great reference from the CDC that talks about quarantining someone who has been exposed. So I encourage you to look at that reference. It's a little bit complicated, but it really does make a lot of sense, and it shows you a calendar and how you determine dates of quarantine, which will be very helpful to all of you. Thank you. What does contact tracing mean? In a perfect world, DHEC would provide us with contact tracing in a timely manner because COVID-19 is so rampant in Greenville County, although our numbers are holding steady, although we last 2-week look back, it looks like we're back on the upward rise, but our numbers of positives are down, so that is a positive. Remember, we're looking back 48 hours prior to that day that a child or a staff member presented with symptoms. So they may call you and say, no, my symptoms started today, and I took a test, and 2 days from now, I learned I'm positive. You need to go back 48 hours from that day their symptoms started. And that may be when they were well, feeling well in the setting of daycare or childcare, pardon me. So you need to look back 48 hours, which it can be a lot of work sometimes. And in the school setting, depending on the age of the student, we need to go all the way back to when they boarded that bus in the morning. And fortunately, we have large school buses. We can socially distance in many instances. My understanding is childcare vans and buses don't have that luxury, and students are sitting next to one another and not always able to keep that 6-foot distance. Sometimes their bus ride is short, and that's something you can look at too. We look at that 15-minute time increments using our best judgment. If they're sitting next to one another and they're in kindergarten, chances are, there very well could be an exposure. Did they keep a mask on? Were they sharing food? Were they touching one another? Those sorts of things. And you would probably have to rely on your bus driver for that information. Pods or classroom settings, you want to look at those settings, and we'll talk more about cohorts and how important it is to keep your group small and groups together. Siblings of a person that is positive, or even children of a staff member in your setting, looking at that piece and quarantining all those folks that were 6 feet, within 6 feet greater than 15 minutes, and the other caveats of sharing drinks or hugging and kissing for a 14-day total. I will tell you what I like to do is look at that last day of contact and going forward 14 days, and they may return to the setting the 15th day. It really matters the timing of it all, but I start day of last contact, 14 days forward, and that 15th day is the day they may return to your setting. Sometimes that's a Saturday or Sunday, so you would bump it up to the Monday, of course, unless you have weekend care. Encourage parents to communicate their exposures to school. I can't stress that enough, how important that is to decrease, spread of the illness. If they should not be in the daycare setting, they should not be in the school setting, and vice versa. If we have a student that has reported a positive or reported an exposure, we will encourage parents as well to make sure they are communicating with all, places where the students may have been, be it church, be it at a child care setting. Contact tracing spreadsheet, I put a question mark there. DHEC has provided school with a nice spreadsheet. I know Julie has talked about creating their own contact tracing sheet for their child care settings. I have reached out to DHEC. If any one of you know of a tool DHEC has provided for child care settings, please share that with all of us. I encourage you to create one of your own. If you don't have one, I will continue to reach out to DHEC and see if we can modify ours for use in other child care settings in Greenville County. Next slide. This is a beautiful graphic that our communications department developed from my lame attempt to create a graphic. It's really nice. I think you will enjoy it too. It's just a snapshot of what it would look like, cohorting students. So they're leaving school where they are cohorted in school. They are getting on a bus headed out to their child care settings, which is smaller bus. And so you want to make sure you're looking at that. They arrive at your center. Hopefully they're being then farmed off to smaller groups, which they will stay in the entire time and not have an opportunity to interact with other groups. That would be best case scenario. If you can at all set up your child care centers this way, this is best practice to keep exposure at a minimum, so that you are not having to question and really ask each individual student in this large group where you're within 6 feet for greater than 15 minutes. Sometimes you're looking at 5 days behind, and that is very difficult for staff to remember, and much less a student. Remember, larger groups make it so much more difficult to identify close contact. Keep those cohorts as small as possible. I know that can be more challenging for some centers than others. You will learn that it makes contact tracing easier, makes your job easier, and it also will decrease the spread of illness in your facility, and that's with staff members too. And remember that when you have staff members and break rooms, and people naturally want to come together and talk and communicate, and just socialize. It's important to stay 6 feet apart. I can't stress that enough. And we have that challenge in the school system as well. I think we're doing a real good job of communicating that and making sure that we're sending out reminders frequently. And again, please, if you do have an exposure in the daycare setting or you have a positive case, to stress to the parent, please report that to the school administrators of your student's school, and that way we can communicate, and if it's a positive, we can make sure we're contact tracing as well, because it could be a student at your center that wasn't identified there, but we may identify it as a close contact in our setting. We can move to the next slide there. I created this flow chart. It's kind of a hybrid of what we use in the school setting. If you if you identify a positive case in your setting. So I'll start at the top and then move right and then go back to the top and move down. So if you identify a positive case, that positive case must isolate from 10 days. Remember, if it's a symptomatic case, it's 10 days from when that student or staff member develop symptoms. Moving forward 10 days, that 11th day is when they can return. You're going to determine that return date. You're going to notify parents, and moving to the right, that student may return. You want to communicate these important criteria. That student or staff member can return to your facility 10 days after the date the symptoms started. And again, that's a minimum. We have some cases that are more severe and are followed by a physician and may require a physician note to return, or that they might have some sort of immune compromised condition and they may need to isolate upwards to 20 days. And that's be a unique situation that that person should communicate with you. In addition, 24 hours passed since the last fever, which is 100.4 or greater, without any medication reducing that fever. And again, overall symptom improvement. Going back to the middle, you're going to, after notifying parents of that criteria, you're going to encourage the parents to communicate any isolation or quarantine dates with the school. And we will again go through the whole process and make sure that we're all in agreement about the dates. Even if DHEC calls you and tells you what the dates are, I encourage you to look at a calendar and make sure that you're in sync with those dates and those dates make sense to you. Back up to the top, we're going to determine close contact exposures then when we get a student that must isolate. That's positive. To the left, going down, up to two days prior to symptoms, up to 2 days prior to the date of the test, if asymptomatic. Remember, you're looking at exposures within your facility, exposures on that transportation piece, and any siblings attending your program of someone who's positive certainly need to be quarantined for 14 days. Remember, this is key, DHEC recommends testing no sooner than 7 days if you are quarantined. In fact, they encourage that after the date of first contact, 7 days into it. But remember, a negative test does not eliminate the need to quarantine for the full 14 days. Even if a student tests negative, they still need to quarantine for 14 days because the incubation period for COVID-19 is 2 through 14 days. So any time within there, it has been determined that they could develop symptoms or they could develop an asymptomatic case even up to 14 days. So remember, they must continue quarantining. We applaud a negative case. We're glad to hear that. That is a positive sign, but it doesn't eliminate the need to quarantine. And again, on the bottom, DHEC reporting, I'm working real hard to try to identify the DHEC requirements for a positive in your setting and how you would report that to DHEC. Because labs and primary care settings or any setting that identifies a positive should be reporting to DHEC, but that doesn't always happen. So we want to be that second tier and encourage our childcare settings and schools to report a positive case. They may have it already, and sometimes they don't, which I have learned happens frequently, especially in an area of high spread. And again, I have a little reference on the bottom there that will be helpful to you, and feel very confident you have received DHEC's childcare interim guidance, but that's there. And if you haven't received it, please read it. It's excellent information. Next slide. And this, I believe, is the last slide. And this was created by our awesome communications department. And it's just kind of in a snapshot of 5 different scenarios in the school setting and you can easily switch out notify school to notify childcare setting. So the top is symptoms of COVID, notify the facility, get a COVID test, stay at home, let us know what your results are. You're confirmed COVID, you received a positive test from a lab. You're going to let your childcare setting know. You're going to stay home at least a minimum of 10 days. When your symptoms are improved, you have no fever, you may return. If you have a negative test, wonderful. You let school know and you follow medical advice. If that means you should quarantine, you should be quarantined, please quarantine. If you have symptoms that led you to test, that's great, you're negative, but you'll still need to follow medical advice or the DHEC exclusion list, which we all know we need to exclude students and childcare participants for different things like fever, diarrhea, vomiting, strep throat, to name a few. Close contact exposure, of course, you're going to let your childcare setting know and stay at home for 14 days despite a negative test within those 14 days. If you live with someone who's positive, this is kind of special. You want to let childcare setting know, but you have to stay home for possibly 24 days. Remember, if you live with someone who's positive and you're going to have daily contact, which is most children who are at a daycare setting or in an elementary setting, you will continue to be exposed every day of those 10 days. So your quarantine starts at 0 at every day of those 10 days. So you'll have to, on day 10, add 14 more days, which is a good long time, but again, makes sense when you look at it at daily exposure to COVID-19. So please remember that caveat there, and that is in that quarantine CDC reference that I had, I think on the second or third slide in there. Excellent reference, shows a calendar and shows this this scenario and explains it really well for you. I think that was my last slide. Are there any questions? It's a very complex situation and ever-changing. So I hope this is going to be a good resource for you and for others. And I will do my best to get an answer for DHEC of a tool you can use for contact tracing within your setting.
Thank you, Janet. We had one question. Is it 15 minutes of exposure total, not consecutive, correct?
That's a great question, and I'm sorry I did not talk more about that. It is cumulative. It is not consecutive. So if you, for instance, rode the bus to daycare sitting next to another student, and your hands were in your lap and you had your mask on the whole time, and it was a 9-minute ride, you know, okay, but then you're in the cohort together, and you know, we can determine that you did have close contact interactions, less than 15 minutes, but more than 5 minutes or 6 minutes, you know, if we're getting down to, you know, that's where judgment comes in. You know, if it's a younger student, you can probably err on the side of caution and call them a close contact. Even for adults, staff members, if you're interacting throughout the day within 6 feet, but it's less than 15 minutes, but it is over a span of 8 hours, you probably are going to be considered a close contact.
Thank you.
Mm-hmm.
All right, that was all super helpful information. And as a reminder, we will be sharing this on our website. I assume y'all will maybe send me a copy of a PDF of the slides that we can also put on there for your reference as well. So I am going to turn it over to Julie now. And I'm going to switch our PowerPoint. All right, Julie with the YMCA is going to kind of share what they've been doing at the Y.
Great. Thank you for having me. I'm very excited to have this opportunity to talk about the experience that the YMCA has had in providing childcare services during a really critical time. The YMCA has been providing childcare services since March. We have been providing emergency childcare when the pandemic first hit, and providing childcare services for medical professionals and also first responders. And we also provided in-person summer day camp programming for 400 children in 5 YMCA locations, and now providing full-day e-learning programming within a childcare setting. And within each of those programs, I think it's important to reference those. We have learned so much. We have learned how to translate the guidelines that Janet was speaking through. And I think that's really important because as you review the state childcare guidelines and figure out how does that complement the programs that we do, how does that translate into the world that we once knew, and how do we provide a healthy environment for all, this is the portion I'm going to go over because this was probably the hardest part for us to figure out, is how to make this language a reality and how do we implement this into program operations. So I'm going to provide you a top 10 best practices list, and a lot of those complement what Janet's presentation is, but I'm going to kind of teach you some of the things that we learned that might be helpful tricks for you in your programs during this time. So we'll go to the first slide. And our first slide, we'll be talking about, I think one of the first best practices is understanding the guidelines that have been given to you. And there's multiple different entities where you can find those. We want to follow DHEC guidelines, our state childcare guidelines, which are different than school guidelines, I found out recently this week. And if there's any agency guidelines that you might have. So for us as the YMCA, we have the YMCA of the USA, which is a national entity, and they also provided guidelines for us to be able to provide as well too. And so I think the thing that's really led to us having success in childcare programming is understanding those guidelines like it is critical for the success of your programs, and to understand that they're not barriers for you, but they're there to protect you. Not only do you need to know those guidelines, but your staff need to know those guidelines. Sometimes your parents need to know those guidelines. They need to understand the why behind why maybe your policies and your procedures have changed, whether it's in drop-off or whether it is, maybe certain requirements that are given now for your program. And you should not stray from those guidelines. As you deliver out of school time programs and you become a little bit more comfortable with the guidelines, we have to still be diligent as if they're new, right? We don't want to become lazy in those guidelines, maybe not practice social distancing as great as we had before. So you want to make sure that you're having that space where you're providing continual training for your staff and reminding yourself of the guidelines, and understand when those get updated. So just because they've been released maybe a week prior, it does not mean that those will stay constant, because as new information is being given, they change and adjust. So understanding how to find those updates and how to deliver those updates to your staff to implement those into your program. So making sure you stay diligent to all the guidelines that have been presented to you and understanding them is a key to the success of your health of your community and your programs and your staff. We can go to the next slide. So health screenings, this is another best practice. So the child care state guidelines state that when anyone comes into your program, that is staff and that is also participants, they must have their temperature checked daily. And as Janet mentioned, that number is 100.4. So if it's higher, they should not be able to, they cannot come to your program. How we have implemented that within the YMCA is that the parent has to stay on site when the temperature check is given. So they cannot leave until that is given, and also their health screening questions have been asked. The guidelines also state that curbside drop-off and pickup is mandatory. So you do not want parents to be coming in and out of your programs, which is is different for us. So a lot of times, you know, we might have that family engagement piece where they come into our buildings, see what we're doing, might want to have a conversation with the director, but for the safety of all, we need to make sure that we're following that state guideline and having curbside drop off. And when your staff member is providing that service, making sure they're masked up. And another best practice to add on top of that is maybe having the same person conduct that to reduce the risk of having multiple people exposure to parents and to children in that setting. All right, next slide. Okay, Janet talked a lot about this, and I want to go a little bit more in depth on how this translates into a program setting. So mixing of groups. Per our state guidelines, they're following what DSS says. So for children that are 5 years and under, the group size cannot be larger than 20. And then for children 6 years and older, they cannot be in groups larger than 23. The YMCA did not feel comfortable with these group sizes. We felt that they were too large. So what we're doing is our cohort sizes are 11 children and 1 staff member. So that's another way to interpret the guidelines. Even though they're set for you, you can also do them at a much safer setting if that's what your facility can manage, if your staff, it also manages on your program space as well too. So thinking about all program spaces that you have and the 6-foot distancing, what is that huddle size group, or what is that group that allows for that space? So even though our state guidelines might say 20 children that are 5 and younger, your space might only allow for maybe 10 to be safely in that space for the 6-foot distancing. So I really encourage you to look at your group sizes to make sure that they are the appropriate size, that are at or below the state guidelines, and that also match the size of the program space that you're hosting that activity in. We also want to be very, very diligent in mixing of groups. So how we operate that is we have the same huddle group and the same staff member throughout all program times, days, and weeks as much as we can. We do not mix those. We don't have floaters that go from group to group. We want to make sure that those mixing of groups is eliminated in everything that we do. In that graphic that Janet showed where it talks about the mixing of groups, I also want you to think through program spaces such as outdoor spaces, because that is something that DHEC recommends we try to do as much outdoor space time as possible. But then also your buses are program spaces as well too. So when you're thinking of group sizes, making sure you have the same kids on the roster, you're not mixing multiple groups of children on your buses and then going into huddle size groups. And so there is multiple layers. They're going from school, if you're transporting, and then going to your facility and maybe any other activities that are going on at that time. The YMCA actually decided not to offer transportation at this time because we could not figure out the way to eliminate the mixing of groups. And so we are not implementing that service at this time. But that is completely up to each out-of-school time provider, just making sure we follow those guidelines that have been given to us by the state in transportation, which is 50% of your capacity on your bus size, making sure that you're masked up, also having the spacing, 1 child per seat, and then your plexiglass that is up there. So making sure that you're following all those guidelines if you're following the transportation, and then the cleaning services that are required with that as well too. All right, next slide. So social distancing, I think Janet did a really, really good job of giving us that definition of what social distancing is. And I think we've heard that term a lot. So it's 6 feet and obviously having a minimal amount of time and close contact. So there's been some really creative ways in how we've done that, because I don't know about you all, but that was really difficult because in out of school time programming, we are really close together. There's a lot of group work that happens, a lot of teamwork activities that we do that require close contact. And so we had to be very strategic, not only in identifying how many children can be in a space, but also looking at our tables, based on the shape of our tables, how many children can sit, what does the spacing of the tables look like? And then we decided to make it fun. We started incorporating things that would help children understand what social distancing is. And so we incorporated hula hoops, so if we're in the gym and we're playing an activity, a hula hoop is a really good visual of a 6-foot distance, and we can make a game out of that. So trying to be creative in finding that space where kids understand social distancing. It's a great reminder for our staff. There's lots of cool visuals that you can do to make your program space fun. I've seen a lot of them is like, if you like your friend, keep a llama distance, a 6-foot llama distance away, and it shows that a llama's span would be 6 feet, So there's a lot of fun, creative ways that as childcare providers, we are equipped to be able to do. So even though it is not familiar to us, we can make it fun. Also, if you go on the Kidding Around website, there are some training resources that have been provided for all out-of-school time providers, and there is a list that is really comprehensive list of how you can incorporate social distancing in your programs, and then also really fun games that have been readjusted that LiveWell has put together that you can incorporate within your programs for physical activities, some of our catch games that have the new social distancing requirements. So make sure that you use that resource and find that to be a great complement to your programs. All right, next slide. Cleaning. We cannot clean enough, right? And so some best practices is anytime that anybody comes into your program, so when staff become on their shifts and when children enter your programs, they should always be washing their hands with warm water and soap. I think the best practice is singing the ABCs to make sure they get that 20 seconds in the washing of hands. Also before and after meal times and after restroom use. So practicing good hygiene, which we should be doing anyway. Making sure that all your areas are wiped down in between transitions. One of the things the Y did is we actually created a new job called a support staff that literally cleans after every group leaves. And that is thinking of all the areas. We also encourage the kids to clean, obviously, before they leave, but the staff person cleans in length with the tables and chairs and doorknobs. We do not allow them to have water bottles. They only the fill water bottles we're able to have. Our water fountains are closed. So thinking of all those high traffic areas and making sure they're cleaned. And if you go onto the CDC website, you can find the correct chemicals and cleaning products that you should be using to disinfect your areas. One of the things that I learned is when I typically clean, I spray and I wipe right away, but I have learned that you should spray and let it sit for 15 to 20 seconds, and then you wipe down that area. And so there's also the backpacks that you could purchase if you have the funding for that, or if that's something you want to use with your CARES Act funding. So there's all different types of materials for you, making sure that when you're cleaning, you're using your gloves as well. So lots of great resources for you on the CDC website to make sure that you're keeping your areas clean. Next slide. Masks. All right, so this is in true transparency something that we have grown into. So when the pandemic first hit, we actually required our staff to wear masks. Also, a majority of our summer camp season, our staff wore masks, but then we required our children to wear masks. So that didn't come until a little bit later. We have decided to adopt Greenville County Schools mask policy. We felt that as more research was coming about, that we needed to shift and adapt to make sure we're providing the safest environment possible. And so if you're not familiar with the Greenville County Schools policy, it's listed below, but all staff are required to wear masks. All children are, and then those that are K4 through first, we recommend and we try to teach and support them in our out-of-school time program, so that when they go to school, we're being consistent with what's required with them there. And I think that's a really good partnership to have, so that the kids are getting the consistency of what's required for them. And then, of course, if those that might not be able to measure, they're medically fragile or might have some health underlying issues, they might not be able to wear a mask. We just require them to bring a doctor's note to be able to honor that. And it's actually been really wonderful to see that the kids are saying, okay, put your mask up, it needs to be over your nose, and teaching the proper way to be able to do those, to wear those masks where before we're like, kids, children won't wear masks, like, but they will, and I think it's our social responsibility to make sure that we follow those guidelines, and if we can support the school system in that, I think that that would be a really great benefit to not only our programs, the school, but also our community. Next. All right, Janet talked about this, and I cannot stress this enough. Parent communication is critical. So thinking about all the areas in your program where you communicate with your parents, if it's through parents' newsletters, if it's through Rides In, Rides Out, if it's through text apps, whatever that might be, a Remind Me app, making sure that you're letting your parents know. We have a standing section in our newsletter that says, you know, if your child has symptoms or anybody has been exposed, here's what you need to do. I think it's also important in our out of school time settings, as always, is to build those relationships with those parents so they feel comfortable talking to you if something feels off. We've had a lot of parents saying, I'm not sure what to do, but this came up, and we can walk them through that. But being sure that we're being diligent and making sure that we're providing that space for parents will communicate to us, and then in return, giving them the reminder that thank you for disclosing to us. Remember that any other programs, including the school, needs to know about this, and for being a good partner and making sure that all entities get that communication through that parent of what that family circumstance might be due to COVID. So parent communication is critical. Next. Right. So staff wellness policy. So typically in childcare, I know I have been guilty of this before pre-COVID. If you're not feeling well, if you might have a little cough, we push through, right? We have a job to do, we have a responsibility, but we have to shift our culture. With COVID and this pandemic, we have to really train our staff that if they are not feeling well, we want them to be home, and we want them to take care of themselves and to report any symptoms or anything that might be an onset, whether it's just allergies, whether they're getting tested, or they have a stomach bug. We want them to stay home. That is very different from what we are used to operating with. And we know that this can be an inconvenience to your program operations if a staff member calls in, but we have to create the environment where when a staff member calls in, we say, take care of yourself. We want to make sure that you're well. Thank you for protecting our programs and our staff and our families by self-reporting. We have to make sure that anybody that does not feel well stays home. That is imperative to the health of our programs. Next. Individual activity kits. So in the DHEC guidelines and CDC, it's recommended that we do not share equipment. And so what we have done at the Y is we have provided the kids with individual kits. That could be done through a number of different ways. It could be through a partner that you have that maybe wants to contribute to your program. It could be, you know, what the school does, and they say, here's the requirements of what we need as far as the school supply list. You can do the same thing for out of school time providers, but we should not be doing family style when it comes to arts and crafts or activities. Everyone should have their own sets of supplies, such as pencils and markers and scissors and glue sticks and things of that nature. You manage that, whether they stay at the program or whether they come home, that's completely up to you. I want to make sure that we're minimizing the risk of exposure through spreading. So that is why that is really important in your program. One of the things that we want to is we try to the books that we use, they are not a hardcover book, they're out of play. We try not to use, or we use electronics to read a story, so that's easily wipeable. And remember that also includes your sporting equipment that you use. So we have switched from like contact sports to clinic when it comes to recreational activities. So everybody would have a ball, or you're focusing on your endurance when it comes to catch games and you're not even using equipment, because we all know that brain breaks are really important as we are leading this learning in our out of school time environment. And again, there's activities on the Ground website that you can look through, as well as supply activity kit lists that are listed as well. And the final slide. outside. So this is new to a lot of us. A lot of us would have parents that come into our program. We thrive on parent engagement and family engagement. So big gatherings is something that we're used to. A lot of us in our out of school time arenas would have maybe on-site field trips and things of that nature. Per childcare guidelines, it's a strong recommendation that you limit the access of outdoor visitors, outside visitors. At the Y, we haven't budged that. We're not ready to let any on-site visitors come into our programs. That is just a decision that we have made, and that is there to protect your programs and to make sure that we are minimizing the risk and the increase of spread when it comes to programs. So the recommendation is that you limit the access to outside visitors, or you can make the decision that at this time, or CDC has lifted, that no outside visitors will be allowed onto your property and into your programs. So those are the top 10 best practices. Again, a lot of that complements what Janet has spoken, but I also think that it's important to understand how that can translate into your programs. Looking over all the guidelines can be very overwhelming, and we spent a lot of time trying to figure out, what does this mean for what we used to know for our programs, and what does this mean for our new program, and how do we marry what we are known for in out of school time, but how do we also enhance to make sure the health and safety and well-being of our community is also met, so we can be socially responsible. So I hope that these best practices helps you in navigating best practices for your out of school time. And I believe this will become a PDF as well onto the First Steps website, so you can use this as a reference for future. And then I'm available. My contact information is listed below, and you're welcome to email me, and I can help you through any of those questions that you might have to navigate through your programs.
Thank you, Julie. That was all incredibly helpful. I hope that kind of those guidelines and kind of top 10 are helpful for you all. What we wanted to do is just take a quick few minutes to throw out a couple scenarios. And Janet, I'm going to unmute you as well. So if either of you want to jump in and try and tackle these scenarios. These are two. The first one, a child in a group of 10 kids gets sick during your program. He has shortness of breath, has a worsening cough, and cannot smell. What would you do?
Janet, do you want to take that, or do you want me to take it?
Go ahead, Julie. Janet.
Okay, I'll do this first one. So if a child is sick in your program and has shortness of breath, you want to make sure that you separate that child from the group. You should have identified in your program space an isolation room, and that room is only to be used to isolate anyone that is not feeling well, whether you think they have COVID, they might have symptoms, or whether you think it's something else. I think it's important for us to remember that we are not medical professionals, so we have to treat every symptom as if it is a case that needs to be isolated. We also want to make sure that when that child is in isolation, that we provide that child with a mask, because there will be a staff member that's in there. So both the participant and the staff member should have a mask on when they are in that isolation. The next step that you should do is contact the parent to let the parent know that that child needs to be picked up and they're showing signs and symptoms. You'll want to remove all the participants and the staff from the space that the child was in, or any of the spaces that that child was in during that day, and making sure that that space is disinfected and clean according to the CDC guidelines. The child should be tested for COVID-19 and should not return until all the criteria has been met. And we discussed that a little bit earlier in our slideshow. So 10 days since the symptoms have passed, they're fever-free for 24 hours without fever-reducing medication. And Janet went over that is ibuprofen and Tylenol. And there's overall improvement in symptoms. So remember, it's those 3 different categories that we have to show those markers for. And then we want to prepare the communication that needs to go out to the staff and participants if they need to quarantine if the test becomes positive, for all those that's been close contact, and then making sure that we do the contact tracing and contact VHEC on top of that. So that's kind of a step-by-step process, is if someone does test positive and or if somebody is having symptoms, what you should do in your programs.
Great, thank you. Our next scenario is a staff member calls you over the weekend to tell you that she is not feeling well and is being tested for COVID-19. What steps should you take while you're waiting for their results?
Well, my recommendation for this one would be to interview that staff member immediately on the phone, asking when the symptoms started and doing a 48-hour look back. Even though it could be a myriad of reasons, they had a worsening cough, say. It doesn't always have to be COVID, but while you have that staff member on the phone, ask the past 48 hours. So maybe it was Saturday she called you. It would be Friday and Thursday. Were you within 6 feet for greater than 15 minutes of anyone in our childcare facility? Write those names down. If 2 days later, she calls back on a Tuesday morning and says, hey, it was negative, then you can just throw that piece of paper away. But it's very important to take advantage of that time when you have an employee on the phone or a parent on the phone and get as much information as possible. If you wait till Tuesday, I can promise you that staff member will not remember who they were in contact with on Thursday and Friday. So that's one real important thing to do. In Greenville County, we have such an excellent social distancing and masking policy that we do not quarantine folks until we have a positive test. Now, that may be different in your facility. If someone is being tested for it, you may start to quarantine. I'm not sure how that looks, but because COVID-19 can mimic so many other conditions, we will not quarantine until we are sure there is a positive. But in my, so you'll have to decide in your setting what your protocols are. But having that person on the phone and getting that information immediately is essential.
Great, thank you. I think that was our last scenario. We appreciate each of you being here today. Thank you to Julie and to Janet for sharing what your organizations are doing. I hope that this is really helpful for the providers who have school age programs, but also in the childcare setting as well. Knowing that there's so much information out there, I hope that this has kind of boiled down some of the best practices and procedures to make your lives a little bit easier. Again, the PowerPoints and the recording of this will be shared on greenvillefirststeps.org/CARES Act. Some of these will also be included on the Kidding Around Greenville resource page. So feel free to always reach out to me should you have questions after this, or want more information, or for us to help get you connected with Janet or Julie as well for more expertise. So thank you all for being here, and we appreciate you and everything that you're doing.
Ann-Lee, can I say one last thing?
Yes, please.
I'm sorry I forgot to mention, as I was encouraging all of you to encourage the parents of students who report positive tests to let the administration of their schools know. It's important that we remember that it's medical information and it really needs to come from the parent. As much as we'd appreciate you letting us know, really that violates HIPAA, which is, the protection of medical information. So while you may be able to report that to DHEC, you really shouldn't share that with others unless you have written parental permission. So please just remember that piece of it. I know that's always in the forefront of my mind. just encouraging them to let us know would be wonderful. And thank you all.
Thank you. Hope you all have a good day.